Helicobacter pylori, commonly called H. pylori, is a type of bacteria that infects the stomach and the small bowel. It was discovered in 1982 by two Australian researchers who also found that it causes peptic ulcer disease. Peptic ulcers are open sores in the lining of the stomach or the upper part of the small intestine. Hey Internet, this is Armation Studio, Medicine Simply Explained. How do you get H. pylori? H. pylori is a contagious bacterium. It's likely transmitted person to person through either fecal or oral exposure, such as eating contaminated food or drinking contaminated water or swimming in contaminated bodies of water, or oral to oral exposure, such as kissing or sharing toothbrushes. Not a good idea. H. pylori is a common type of bacteria that grows in the digestive tract and has also a tendency to attack the stomach lining. It infects the stomachs of roughly 60% of the world's adult population. Helico means spiral, which indicates the bacteria are spiral shaped. The spiral shape of a H. pylori allows them to penetrate your stomach lining. The bacteria can interfere with your immune response and ensure that they are not destroyed. This can lead to stomach problems. Stomach acid and H. pylori together irritate the stomach lining and may cause ulcers in your stomach or duodenum, which is the first part of your small intestine. When the infection leads to an ulcer, symptoms may include abdominal pain, especially when your stomach is empty at night or a few hours after meals. The pain is usually described as a gnawing pain, and it may come and go. Eating or taking antacid drug may relieve the pain. Other symptoms include excessive burping, feeling bloated, nausea, heartburn, lack of appetite, and unexplained weight loss. There are ways to diagnose H. pylori. One of them is blood test. You may need to give blood samples, which will be used to look for antibodies against H. pylori. For a blood test, a healthcare provider will draw a small amount of blood from your arm or hand. The blood will then be sent to a lab for analysis. This is only helpful if you've never been treated for H. pylori before. A stool test. A stool sample may be needed to check for the signs of the H. pylori in your feces. Your doctor will give you a container to take home with you to cache and store a sample of your stool. Once you return the container to a healthcare provider, they will send the sample to the lab for further analysis. This and the breath test usually will require you to stop medications such as antibiotics and proton pump inhibitors before the test. Breath test. If you have a breath test, you will swallow a preparation containing urea. If H. pylori bacteria are present, they will release an enzyme that breaks down this combination and will release carbon dioxide, which a special device then detects. Endoscopy. If you have an endoscopy, your doctor will insert a long, thin instrument called an endoscope into your mouth and down into your stomach and duodenum. An attached camera will send back images on a monitor for your doctor to view. Any abnormal areas will be inspected. If necessary, special tools used with the endoscope will allow your doctor to take samples from these areas. How can we treat H. pylori? You will normally need to take a combination of two different antibiotics together with another drug that reduces your stomach acid. Lowering stomach acid helps the antibiotics work more effectively. This treatment is sometimes referred to as a triple therapy. There is no evidence that food and nutrition play a role in preventing or causing peptic ulcer disease in people infected with H. pylori. However, spicy food, alcohol, and smoking may worsen a peptic ulcer and prevent it from healing properly. Now the question is, can you get reinfected with H. pylori? Recurrence of H. pylori after a successful eradication is rare in developed countries and more frequent in developing countries. Recolonization of the same strain rather than reinfection is considered more likely to be responsible in most of the cases. The other question you may have is, if I'm infected with H. pylori, does it mean my family is too? Scientists suspect that H. pylori infection may be contagious because the infection seems to run in families and is more common where people live in crowded or unsanitary conditions. Although research suggests that infection is passed from person to person, exactly how this happens isn't really known. According to a study by Y.S. Sari in 2008, the present results indicate bad environmental hygienic conditions and close intrafamilial relationships are important in H. pylori contamination. These findings indicate all family members of a H. pylori positive individual should be assessed for H. pylori positivity, particularly in developing countries where the H. pylori prevalence is high. They also suggest patients, their spouses, and all H. pylori positive family members of the H. pylori positive individuals should be treated for H. pylori infection. Hope this video was useful. If you have any more questions regarding H. pylori or H. pylori infection, feel free to ask in the comments below. If you liked the video, please consider subscribing to our channel for more healthcare related videos.